afternoon, everyone, and thank you for joining us for today's webinar, COVID Stress Syndrome, Managing in the Midst of a Global Pandemic. With me, I have Dr. Marty Kubik, our new director of the School of Nursing. She will walk us through a wonderful and talented panel of speakers today. We will be accepting questions via chat. If you do have a question for any of the panelists, please submit it to me as the host, and we will answer those questions at the end of the session. The session is being recorded, and we will share this with all who have registered for the event, and it will be posted to our website afterwards. Thank you so much, and with that, I will turn it over to Dr. Kubik.
Thank you, Michelle. Welcome, everyone, and thanks for joining us for this very important and very timely webinar this afternoon. I have the pleasure of introducing our three panelists. I will start with Dr. Michael Rebbe. Dr. Repie is the Senior Director of Clinical Services at Dominion Hospital, where he's responsible for clinical oversight and participates as part of the senior leadership team there. He previously served as Director of Education Services at Dominion. Dr. Repie is also a published author and remains active on the faculty here at George Mason University. By way of background, he received his BS in secondary education and his MA in special education from West Virginia University, and his Ph.D. in special education with a minor in healthcare administration from George Mason University. Welcome, Dr. Repie. I'm also pleased to introduce Dr. Zixuan Wang. Dr. Wang is a licensed clinical psychologist who works full-time at a group practice, Kent's Psychotherapy in Rockville, Maryland. She works with teenagers and adults and individuals, couples, family, and group therapy. Dr. Wang completed her graduate training at George Washington University's Professional Psychology program and earned her BA in psychology at New York University. She completed her clinical internship at Pennsylvania Hospital and her postdoc fellowship at the Kennedy Krieger Institute Child and Family Therapy Clinic. Dr. Wang has specialized interest in mood disorders, intersecting identity issues, and adjustment and culturalization issues. I take a special pleasure in introducing the third panelist, Dr. Melanie Yusefi, who is an assistant professor here at the School of Nursing at George Mason University. She has worked in the psychiatric field for a number of years and across a variety of settings, including psychiatric inpatient, partial hospitalization settings, as well as outpatient behavioral health areas. Dr. Yousefi is the program coordinator for the Psychiatric Mental Health Nurse Practitioner program here at George Mason. She is also has clinical expertise, including the management of psychiatric conditions of the seriously mentally ill in rural community and mental health settings through telehealth services. In addition to teaching, she is also in private practice at McLean Counseling Center, where she sees children, adolescents, and young adults. By way of educational background, she received her D&P as a psychiatric mental health nurse practitioner here at George Mason, as well as her BSN. So she's Mason proud. I would like to also introduce you to the learning objectives, and then we will turn over the speaker hat to Dr. Repie to lead the way today. So when you complete the webinar series today, you will understand the impact of COVID-19 pandemic across multiple domains. You will have an increased awareness of facts and statistics most impacted by the COVID-19 pandemic. You will have an informed further understanding of the emergence of COVID stress syndrome in particular, its correlates, and its implications. You'll recognize the role that grief and loss play in our current crisis, understand the role that control plays in psychological impact, as well as effective ways to cope with change, stress, fear, and anxiety. You'll be aware of warning signs of mental health impact and when to seek help and encourage others to get help. And by way of resources, we will provide you information as far as support for youth, young adults, and parents. Thank you very much.
Thank you, Dr. Kubik. This is Mike Repie, again, the Senior Director of Clinical Services at Dominion Hospital. And we're going to start today with, I guess, a little lesson in word origins on our first slide regarding principles of epidemiology from the Centers for Disease Control and the like. So a couple terms, perhaps, unfortunately, that we have not heard a lot this year, most prominently the word pandemic. But to progress to a pandemic, an endemic is really an adjective that is most commonly used to describe a disease that is prevalent or restricted to a particular location, region, population. We've heard this term a lot. For example, an endemic or malaria is endemic to tropical regions. We have heard the term outbreak and epidemic to some degree, probably throughout our lifetimes. Oftentimes they're used synonymously. An epidemic is commonly used as a noun, meaning the temporary presence of a disease in our communities, such as the flu, a flu epidemic affecting perhaps Fairfax County. Pandemic, unfortunately, is something of a different nature, and the Greek prefix pan, meaning all, demos, demic, meaning people. So pandemic, the unfortunate reality of 2020, describes an epidemic when it is spread across the globe. And if you hadn't heard recently, shocker, pandemic is the word of the year by Merriam-Webster. And just by coincidence, today we're exactly 9 months to the day when COVID-19 became a pandemic officially in the world. On March 11th, 2020, the WHO, the World Health Organization, declared the novel coronavirus outbreak a pandemic. And searches for the word pandemic in Merriam-Webster's online dictionary were 115,000 times higher than that date last year. And then also mentioning, again, our title, COVID stress syndrome. COVID-19 was coined in February, and 31 days later, COVID became included in the Webster Online Dictionary. We can go to the next slide. So the impact of COVID. Today we're talking about COVID stress syndrome, and I'll break down another word or define another word, syndrome. So what is a syndrome? We have heard that word before as well. But this slide very much depicts why we're talking about COVID stress syndrome. A syndrome is defined as a group of signs or symptoms that occur together, or a set of concurrent things such as emotions or actions that form an identifiable pattern. And if you look at the impact of COVID across this slide, obviously we can understand why we're calling this a syndrome of COVID-related stress. So I work at Dominion Hospital, work in healthcare, have obviously seen firsthand the impact on healthcare, obviously a global health crisis, significant impact on many sectors of healthcare. Obviously today we're going to talk quite a bit about the mental impact on workers. Education, as Dr. Kubik shared my background, significant background in education, obviously significant impact on education, from schools going virtual to teachers and students' mental health and well-being. Obviously the economy, demand shock, supply shock, financial shock, all at one time, impact on business. And then again, we're going to spend a lot of time today talking about mental health And I do want to point out some of this is very impactful. Some of this will affect individuals in different ways. So please feel free to take the opportunity to chat privately to one of the presenters. If you're feeling significantly affected by the discussion today, we can certainly address and can certainly stay on the WebEx after to talk more and to address any individual needs. So obviously mental health, a primary focus of today. Perhaps coming out the best out of all this, the environment. Anthropause, a term that I was not familiar with, but we really have a reduction in human activity, so hopefully some positive impacts related to COVID on the environment, and hopefully some positive impacts that we'll hopefully get to as we go through our presentation. So the next slide we can go to, which is coronavirus facts and statistics. Some of these rather staggering. It was astounding putting this slide together and initially putting some data in here from November and then updating it this week to see how much things have increased in our country. From early November to now, known cases went up from 9 to 15 million. Unfortunately, deaths increased from about 229,000 to 286,000 deaths this week, and worldwide 68 million cases and 1.56 million deaths. And again, we're going to be talking about impact on mental health. A very recent study done by Gallup, which asks Americans each November about their mental and emotional well-being. 34% described their mental health as excellent last month, end of November. That's down about 9% from 43% in 2019. And if you look at the bottom of this slide, some data from earlier in the summer, significant report of U.S. adults struggling with mental health or substance abuse, which again we'll continue to frame here today and hopefully talk about some solutions and interventions. We can go to the next slide, which some of you have perhaps seen recently, the deadliest days in American history. This slide was staggering to me on a number of levels. The unfortunate reality about this slide is it's not up to date, and the deadliest days in American history, 2 days this week, actually need to be number 3 and number 4 on this list. So really a couple things to point out on this slide. First, just how serious the current situation is, and going back to the word pandemic and those implications. But then the second notion is really to call your attention to how you're processing this. When you look at this, what does that what feelings does it bring up for you? How do we process this type of imagery and information? Do you experience anxiety? Do you experience sadness? Do you experience hopelessness or anger even? And then, as we'll talk about in the presentation, what outlets do you have to process this? And thinking of yourself and thinking of your loved ones, those around you. So we can go to the next slide, which, again, we're talking about COVID stress syndrome. And there's a lot on this slide. I'm not going to talk about all of it. I do want to talk about some key points. Maybe you haven't heard the term COVID stress syndrome yet. There's a relatively new term being coined, COVID stress disorder. But really a couple things to highlight in this initial study, which goes back to the early summer, and how individuals were impacted by COVID and COVID stress. If you look in the discussion, a couple bullets to call to your attention is throughout COVID, people were not passive. People were actively trying to find ways to cope. The unfortunate reality from this study, and then very interestingly enough, subsequent research that I've looked at and Dr. Yusefi and Dr. Wang have shared, is that the recent studies are very much in line with this study, that again, individuals are not passive. Unfortunately, the least frequently used coping strategy involves accessing medical or mental health services. And so I think today really a bit of a call to action. I've used I've used the term extraordinary times in many memos I've written this year. We're in extraordinary times. And if you guys all know the quote, extraordinary times call for extraordinary measures. So again, as part of a call to action, really, have your actions on some level been extraordinary this year? Think about our world, think about our country, think about our workplaces, think about our schools, think about how much has changed. Have we changed enough ourselves, consciously enough to deal, or as the title of this presentation says, to manage in the midst of a global pandemic? And one more slide I have for you guys before I turn it over to Dr. Yusefi. Really crystallized for me a couple months ago, COVID stress syndrome, other circumstances, is grief and loss. And the bullet that I'll point out on this slide is cumulative grief. So cumulative grief, sometimes described as grief on top of grief. So we've really had less time, less attention to heal from the losses that we've suffered. And what have we lost? The loss of normalcy, the loss of economic circumstances, the loss of connection. And cumulative grief can be a significant challenge that we need, again, some skills to work through. But I do believe that each of us has the ability to end this pandemic stronger with hopefully some new skills, an abundance of lessons learned. We have to expect and understand that we may not function at the level that we normally do all the time, and that's okay. And as healthcare workers, I know a lot of you guys are, perhaps educational professionals, our focus needs to be on providing. I think the emotions that we're experiencing are obviously confusing, sometimes messy, and we may not be able to give 100% of ourselves each day, and that's okay too. But we have to focus on doing the best that we can in the careers that we have chosen. But again, I'm optimistic that we will come out, hopefully, the other side of this better. And I'm going to pass the mic to Dr. Yusefi, who's going to share some additional information, framing thoughts as we begin to transition to actions that hopefully we can all be taking during these tough times.
Thanks so much, Dr. Repie. I just wanted to add some additional statistics here and survey findings to Dr. Repie's discussion. What I'll be reviewing are reported findings from a nationwide survey that was conducted and published online through the COVID-19 Consortium for Understanding the Public Policy Preferences Across States. And so what this survey actually had found in May of 2020, almost half of young adults reported at least moderate symptoms of depression, and about more than a third reported thoughts of suicide. This is a substantial increase compared to historical data from the National Center for Health Statistics that Dr. Repie had also reported earlier on. Next slide. We're seeing here just this trend of depression and anxiety that's just unchanging in its trajectory. This graph shows how throughout those 4 COVID-19 waves in May, June, August, and October, respondents endorsed ongoing major depressive symptoms, as well as rates of anxiety increasing. Sleep disruption appeared to be the most common symptom, I found. When comparing between genders in the month of October, depression, anxiety, and disrupted sleep were actually higher among women. And then next slide. And then as Dr. Repie had mentioned earlier on the impact of COVID-19, I mean, it's no surprise here that the relation of mental illness to life disruptions caused by this pandemic. This graph compares rates of depressive symptoms among those who did or did not experience an adverse outcome. So adverse outcomes were considered to be school closures, working from home, reduced work, pay cuts, among others that are listed here on this graph. What we found is that the largest increase in depressive symptoms and suicidal thoughts were among those whose homes were impacted. So this could have been from eviction, maybe getting behind on rent or mortgages. Next slide. When examining the comparison of different ethnic groups to psychosocial concerns about COVID-19, there were notable differences. In the month of May, non-Caucasian Americans, African Americans, Asian Americans, Hispanics reported more worries about financial hardships, family or themselves getting coronavirus, or even access to health care compared to Caucasian Americans. Prior to COVID, evidence already suggests of pre-existing social determinants impacting mental health outcomes. So this is just one example of a study done in the UK by IO and investigators that the risk of moderate and severe depressive symptoms were significantly higher in subgroups of people who were experiencing abuse, low social support, and even pre-existing mental and physical conditions. Next slide. What's becoming a growing concern is the rise of maladaptive or unhealthy coping in response to the social isolation by this pandemic. Addiction is known as a disease of isolation, so individuals in recovery or those with ongoing substance use disorders are particularly at risk for worsening of their disease. These individuals have lost their community. They've lost their peer support group. There's a lessened sense of accountability and, of course, readily accessible substances. Other at-risk groups that were identified by the CDC for substance use, suicidal ideation, and a mental health condition were also higher in minority ethnic groups, as we've seen in the survey earlier, unpaid caregivers, and essential workers. One thing I also want to previous slide. One thing I do want to highlight when we're talking about vulnerable groups of patients are those with serious mental illnesses. So these are population of patients with schizophrenia, bipolar disorder, or even severe depression or OCD. These individuals are at a heightened risk for losing access to their care, financial stressors, or even lower treatment adherence. Not being able to see their providers will affect their likelihood to continue their treatment regimen. So likely they may not follow through with their medications. These individuals are also already susceptible to medical comorbidities, so conditions like hypertension, diabetes, obesity. So both their psychiatric and medical condition would likely exacerbate during this time. You can go to the next slide, please. So as Dr. Repie has mentioned regarding grief and what we're seeing as the rising trend of mental health problems, we as a community are facing a collective sense loss of normalcy, security, social connections. Understand that grief is a normal emotional, cognitive, and behavioral response to this loss. We experience this through emotions like numbness, despair, sadness, guilt, in physical symptoms like insomnia, fatigue, lowered appetite. And behaviorally, this can appear as crying or a disorganization of what was once a daily routine. I mean, maybe some of the things that we're talking about today might be bringing up some of these emotions for you. And what we know about grief and what we'll review in resiliency literature is that when the crisis passes, most people do bounce back. Processing grief is done through acceptance of the reality that things will no longer be the same, then processing this pain of loss by recognizing and labeling these emotions and adjusting to this new normal. We can do this through adaptive coping strategies and engaging in meaningful connections. There's no fixed progression when it comes to the grieving process, and grief experts will tell you this. It all depends on the individual. But what's important to emphasize is that it's okay to feel grief over what we're losing and what we've lost, but we can still promote a sense of resiliency. With children, there's been a significant disruption in their lives. Social activities are getting canceled, distance learning, school closures, social distancing from friends. With children, when we talk about resilience, what is it that we do as adults to help promote for kids' capacity to cope under stress with these problems? Kids are trying to make sense of things just as adults are. Children are looking to their parents for leadership in times of crisis. So I'm going to go over some tips for parents to help children cope with their grief. The first thing is to allow them to talk about and label their feelings and to express their grief. Children do this in a number of ways. It may depend on the child's developmental stage, but with young children, they tend to express themselves through play or even maybe reenacting what they're seeing in the media or what's around them. It's important to follow their lead. When talking to your children, use age-appropriate language. Children take their emotional cues from their parents, so it's important for you to model positive self-talk, and modulating your own emotions will help support your child's own emotional regulation. Try to follow the same routines. It's important to create a safe space, so maintaining predictability and a routine will give kids a sense of security. When there's clear expectations of what to expect, there's a decrease in these power struggles, and you'll see this a lot with teenagers. Encourage kids to laugh and play, that despite the problems that we're facing, they can still have fun. So in the home, increasing your time with them through play and reading will really just help promote children's healthy attachments and relationships as they grow on. Try to limit exposure to violence in the media. As I've mentioned before, young kids may not fully understand what's happening in the world, so overexposure to media and adult content may lead to just a deeper sense of confusion and loss. Instead, give them access to age-appropriate media content and ask them about what their understanding is about what's happening. Go to the next slide. What we've seen in resiliency literature are that there are several buffers from stress-related adverse outcomes to crisis. Experiencing trauma doesn't mean you're doomed to fail, and a number of people even manage to thrive under terrible circumstances, what we call post-traumatic growth. One of the most reproducible findings in stress and resiliency literature is that the higher the controllability of a stressful situation, the better the individual is able to cope. So this may start with recognizing what you do have control over. You have control over what you do now to stay healthy. How are you coping with stress? How are you treating others? Or even how much news do you consume? So it may be necessary to take media breaks from time to time. When you catch yourself worrying about a lot of different things that are happening, you can manage this by focusing on one thing at a time and creating an action plan. So maybe start with, what are the resources that you have right now to stay safe? What can you do to contact, who are your resources to contact when you need help with logistics or practical support? And then who can you contact for emotional support? The utmost importance to mitigate loneliness and isolation is promoting the social connectedness, and we've seen that in resiliency literature. Develop strong bonds and connectedness by reaching out to your loved ones, whether through video chats, by phone, going on walks, and not just through text messaging, but actually talking to people. What we've also seen is the people who are really affected are in those vulnerable groups. So check in on people who may be having a difficult time right now. And then try to find opportunities to create positive experiences in your community. So this could be through your school, your church, or even your neighborhood. Next slide, please. Finally, distress is an understandable reaction to what's happening. Modeling adaptive stress management and emotional regulation affects not only you at the individual level, but also at a community level. Dr. Wang will go into more detail regarding self-care, but tenets of the ABCs of self-care include A, for awareness. So determine how you're feeling. What's your stress level right now? Whether your behaviors are consistent with who you want to be. Check in on yourself, just like you would check in on a friend. Give yourself permission to feel those emotions, whatever they may be at the time. Emotions, just like grief, are like waves. They come and they go. So acknowledge that this emotion you're feeling is transient, and practice learning to ride that wave and not be drowned by it. B, for balance. Balance your time among different types of work, personal life, rest, and leisure. Really start looking at how you're allocating your time and energy throughout the day, and make sure that you're squeezing in that time for pleasurable activities, even if it just means 15 minutes to leave your desk and go for a walk. And then connections, building social connections and supportive relationships. And this is with your coworkers, with your friends, with family, and in the community. We can go to the next slide. When it comes to practicing how to regulate emotions and behavior, there are so many ways of doing this. And in fact, one of the good things that are coming out of this pandemic are all of this resources that have become available that are free when it comes to mindfulness and well-being. Relaxation activities like just doing a body scan, creating stress balls, and the Stop, Breathe, and Think app are some of those free resources available. And then there are additional resources and information and links that'll be at the end of these slides for you guys to all access and refer back to. I'm going to hand it over to Dr. Wang, who will go into more detail about mindfulness and well-being.
Thank you, Dr. Yusefi and Dr. Rebbe. So I'll take over the last portion of this presentation by expanding a little bit more on some skills and actions to consider to cope with COVID-related stress. I'll first expanding a bit more on the balance that Dr. Yusefi has mentioned, specifically how to balance between work and your personal life during the pandemic. You can go to the next slide. Thank you. So some action items to consider here. I've only listed out a few, and I'm sure there are so many more that we can add onto this. But these are all built upon the mindfulness skills that Dr. Yusefi has just mentioned, which is the idea that it is to intentionally live with awareness of your thoughts, your feelings, and your behaviors in the present moment, so that you can take more control and hold of your mind to live with more effectiveness in the present. So that could include acknowledging your feelings, either they're positive, negative, or neutral. That means if you're feeling proud and good about yourself, acknowledge that instead of trying to brush it off. Or if you're already feeling exhausted, overwhelmed, it might be a good idea to acknowledge that as well, instead of trying to ignore that and continue to overload yourself with even more work. So that ties into my next point, managing our expectations, especially during such a difficult time like this. We all have a lot of roles that we need to juggle. It's important to remind ourselves that it's okay to not achieve perfection, not right now, not ever. It's always impossible too for us to achieve 100% perfection, even though it's really easy for us to think about wanting to get there. And deciding the role that you need to prioritize in certain situations. Say if you're doing a 9-to-5 job, probably it's a good idea to prioritize your professional role during that chunk of time and try to get your work done as effectively as you could, so that once it's outside of that chunk of time, you could prioritize your personal role by spending more time with your family and your loved ones, and turning off that work email might be a good idea during that time. And my next point, practicing helpful organizing skills. So this is from another way, trying to have more control and mastery over your professional role. If you are working remotely at this point, and if you haven't done so, maybe thinking about creating a dedicated workspace. If it allows trying to set up your study space or your workspace in a different room that is different from where you relax or where you sleep could be helpful. If it's hard to do that, maybe setting aside a specific area, say in your bedroom, where you don't face directly to work, the bed, or a comfortable couch, but designating the space specifically to your work might be helpful. And using skills like actively planning out your day and coping ahead of potentially stressful situations, scheduling your day out, not just the work items, but also maybe something fun and pleasant that is for self-care after you're done with work can be helpful. Establishing a routine or a sense of structure during your day, especially during a time where we're living with so many unpredictabilities at this time. Having a sense of routine and predictability during your day could be really helpful. Being kind to yourself, practicing self-compassion acknowledging your strengths and your accomplishments instead of focusing only on what I'm yet to achieve, right? Limiting the stimuli that can increase your level of stress. It could be that social media break that Dr. Yusefi has just mentioned, or limiting, say, the amount of caffeine that you drink throughout the day, if that tends to increase your level of stress. So be mindful of what tends to be your own stressors and what you can control to manage that. Planning a self-care activity on a regular basis. It could be that walk after dinner with your family or with your dog, or a 10-minute yoga exercise before bedtime. Practicing assertiveness, meaning being able to say no to the things that you know are not good for you, and being able to say yes to the things that you know are good for you or are healthy for you. Staying connected has already been mentioned earlier on. I only want to add in that it can be helpful to think about evaluating who do you want to invest more energy in and in what kind of format. Sometimes it's very easy for us to invest a lot of energy into relationships that are not necessarily the healthiest and can create lots of stress in us. So this can also be a good time to think about what are some of the relationships that are important to me, that are healthy to me, that are good for me, and am I giving them enough attention and energy into this relationship? Doing things like having a weekly check-in meeting with them, say a family member, significant other, a friend, to talk about simply maybe how their day has been going or how their week has been going, to keep each other updated can be a good way to remain connected and decrease the sense of isolation during this time. We can go to the next slide. So next, I want to talk a little bit about recognizing symptoms and when to seek help. And by help, I mean specifically utilizing mental health services during this time. And Dr. Yusefi and Dr. Repie and I were just talking about this yesterday, that we saw some latest surveys showing that during the pandemic, there have been a decrease in people utilizing mental health resources or services at this time. But from my practice, my clinical practice, we've definitely been seeing a trend where a lot of people have been taking a more proactive role and trying to initiate therapy at this time, which is good in a sense that people are trying to, incorporate this into their self-care routine, which I think is really important at this time. So if you can go to the next slide. So here are some common signs which are categorized into some negative feelings, thoughts, or problematic behaviors. I won't be going into them one by one, but I do want to emphasize that all of these negative feelings, thoughts, or behaviors, then by each individual one of them, it doesn't mean that it necessarily indicates psychopathology. And actually, it's really hard for us probably to imagine going through your life without ever experiencing any of these. But if you're finding yourself struggling with these negative feelings or thoughts or behaviors at a much higher frequency, and they tend to last over an extended period of time with higher intensity, and they're negatively impacting how you function in different areas, then probably this is a good time to consider utilizing some mental health resources for your self-care. You can go to the next one. So this has been already mentioned, I think, before, but I guess I just want to say that with the latest research showing that people with pre-existing mental health issues tend to be more vulnerable during the pandemic. They're also at greater risk of developing medical comorbidities in general. For people who are already having some pre-existing mental health issues, it's definitely also good to consider, if you haven't done so, to continue utilizing the mental health services or resources to help cope during this time. You can go to the next one. So for those of you who are not so familiar with therapy or other kinds of treatment modalities yet, I've listed out a couple that are common ones here. So there's psychotherapy, which can take place in the format of individual therapy, group therapy, family therapy, or couples therapy. And they're provided by trained mental health professionals, such as licensed psychologists, social workers, professional counselors, and so on. There are also people who would manage their conditions or their symptoms through medication, and they're usually prescribed by psychiatrists, nurse practitioners, and sometimes the primary care physicians, and so on. And from my work, I've definitely been seeing lots of people who would use the combined approach, so people who are working with a therapist and at the same time taking the medication. Some additional settings for people who are struggling with more severe mental health issues or more severe emotion regulation difficulties, or people who are experiencing a psychiatric crisis. There can be settings like an intensive outpatient program, a partial hospitalization program, and an inpatient hospitalization. And those usually take place in a much more structured setting where people would receive a combination of these services. The last point in my slide, I do want to emphasize that right now is also a very good time to consider utilizing teletherapy as a way, as an additional resource, because lots of states, including Virginia, Maryland, and DC, the governors have lifted the restrictions and mandating most commercial insurance to cover the telehealth and teletherapy services during COVID. You can go to the next one. So the last part of my presentation, I want to talk a little bit more on COVID-19 and the risk of suicide. I do think this is a very important topic because a lot of people are being impacted by this. And like Dr. Rebbe has mentioned earlier on, this topic could be a bit triggering for people. But I do think talking about suicide actually provides the opportunity for communication. And that is the first step. That we can, if we can keep the conversation going, there's an opportunity to learn more about that, to learn more about what actions we can take so that we can also be more prepared to, in terms of how to cope with that. So you can go to the next one. So suicidal thoughts can commonly occur when one feels overwhelmed or can't cope or recover when faced with challenging life situations. There is a difference between passive and active suicidal thoughts. For passive suicidal thoughts or ideation, usually it is triggered by a desire to escape and to detach from the reality. It doesn't necessarily come with a very strong urge or a very clear plan, or even any action to follow that urge. So some common examples could be having thoughts like, I wish I didn't have to wake up the next morning. I wish I could disappear, things like that. Versus active suicidal thoughts would involve a much stronger urge, and it does come with a much clearer plan, or sometimes the urge can be strong enough that the person would act upon that thought. So there is a difference, but both would require a lot of clinical attention, and in our work, a risk assessment and safety planning are always required for both. So even though there hasn't been so much data on specifically how the pandemic has been impacting people's thoughts about suicide, but we do have enough research showing that this has become a global issue. So not just in the U.S., like Dr. Yousefi and Dr. Repie have mentioned earlier on, but also a similar trend of increase in suicidal thoughts or even attempts have been observed in countries like Japan, UK. I think there's another one from South Korea that came out recently, showing that women and young adults tend to be the most highly impacted during this time. So you can go to the next one. So here I listed out some common warning signs of suicide. So talking about suicide, and again, that in itself doesn't mean that the risk of suicide is really increased, even though that is a warning sign of suicide. The next one, planning and getting the means for taking one's own life, for example, buying a gun or stockpiling pills, withdrawing contact with others more than usual, having preoccupation with death or violence, feeling trapped or hopeless for an extended period of time, doing risky or self-destructive things, such as using drugs or driving recklessly, saying goodbye to people as if they won't be seen again, developing personality changes, or being severely anxious or agitated, and last but not least, giving away personal belongings. So what you can do if you're ever in a crisis is that definitely call 911 or going to the nearest emergency room can be some go-to options. Calling local psychiatric crisis intervention clinics, calling the National Suicide Prevention Hotline, which operates 24/7, calling the local suicide prevention hotline. Here is listed the number for the Virginia one, or you can text connect to 855-11. And there's also a youth line and the Trevor Lifeline, which serves the LGBTQ community. There's a 24/7 crisis text line that is also very easily accessible. Reaching out to a family member or a loved one to ask for help, or reaching out to a mental health provider after the immediate crisis passes to continue processing on what has happened. So there are a lot of available resources and a lot of options and actions that can be taken to manage a crisis effectively. So, and these slides will be, I believe, available to you guys afterward too. So these would be, hopefully these would be some helpful resources that you can keep. And if you want to go to my next slide. So what to do if you're recognizing warning signs in a friend or someone you love. The first one is definitely taking these signs seriously. You can offer support by encouraging the person to communicate their thoughts and feelings to you. And be mindful to be respectful and acknowledge the person's feelings instead of being patronizing or judgmental of what the person has shared with you. Never promise to keep someone's suicidal feelings a secret. You can say something like, if I think your life is in danger, I have to get help. Offer reassurance that things can get better. Encourage avoidance of alcohol or substance use. Encourage this person to seek professional help. And also remove potentially dangerous items from the person's home if possible. If it is determined that this person needs more immediate help, definitely offer them the resources of the psychiatric emergency services from the ones that I've listed out earlier on, or you can also offer calling for help for this person. So if you want to go to the next one, here I've listed out some helpful resources in regards to how to find a therapist or therapy resources, helpful mental health information, and also there are some websites where they have lots of resources that provide more extensive articles about how to cope during the pandemic. And I believe the next one, we also have even more resources about helping parents to support their children and teens. Dr. Yusefi, do you want to talk a bit more about this slide?
Oh, sure. This is just an added resource for those of you who are parents of young children or teenagers. A few of these are links that can offer some common language that you can use that are age appropriate. PBS Kids is a age appropriate media content that you can use as a resource. And then a few others are, self-care strategies that you can teach your children. I mean, if there's one thing that hope that all of you take away from this is that you sort of can start modeling a lot of these adaptive and coping strategies that kids will learn and will take with them as they get older. And then lastly, National Domestic Violence Hotline, just because what we've seen is that there has been a rise of cases, of abuse cases with the social distancing and quarantining. So having this resource available is there for you.
And I believe that would conclude our presentation.
Thank you very much to everyone for sharing many resources that are available to anyone who is either in practice or may have those in their lives that have some concerns. We do have a number of questions coming in, and I encourage everybody to submit their questions via the chat. Can each of you share your thoughts on stigma and the stigma associated with seeking mental health services during the pandemic, especially for leaders and for those in the healthcare industry? We can start with Dr. Repie.
Yeah, it's a great question. I'm optimistic about stigma in mental health, and having worked in this field for really 25 years now, I've really, I think, optimistically seen it progress, that it's not that, dirty little secret anymore, and that individuals do and should feel supported at every level, regardless of job, regardless of title, regardless of social status, any other demographic factor. Here at Dominion, talk a lot about self-care. We talk as leaders about starting with ourselves and hopefully modeling self-care and mental wellness. In fact, it's one of our rounding questions. So hopefully you are comfortable talking about that. And then also highlighting, we didn't mention as part of this presentation, EAPs, those employee assistance programs and resources that may be available. So again, I'm optimistic that hopefully we're progressing to a climate where this is, less of a stigma issue and more of, we all experience this from time to time and can seek help and shouldn't feel any shame or guilt in doing so.
And I'll just add on to that, Dr. Repie, is that, I think those are great resources, the Employee Assistance Program. On Mason, we do have available psychological resources available to students, to staff, to administrative staff, to faculty. But one thing I wanted to add on in regard to stigma, and it's an interesting thing that I've seen, is the younger generation and younger clients are now more able and open to talk about mental health. I mean, I think the climate about mental health has changed, and how it's talked about, and what we're talking about in social media now with the younger generation. But as far as in leadership, I think it also has to do with the sort of workplace culture. And I think the more often we're able to talk about and acknowledge feelings that are coming up, the less of a stigma it's going to become in terms of being able to seek help when you need it.
And I agree with both of you. I definitely share the optimism in a sense that from my own experience, I've definitely been seeing more people being more open to sharing and talking about their experience with working with a therapist or utilizing other kinds of mental health resources. And you definitely see that being also more widely talked about in social media. I also agree with you, Dr. Yousefi, that from my work with teenagers, it's definitely really, even like it gives me a sense of pride too, to see sometimes teenagers would talk about them using therapy as a way for their own self-care. And it's just such a normalized thing to talk about among their peers nowadays. which is really good to hear. But yeah, in addition to that, I guess as far as for leadership, I think definitely more outreach into different communities, and especially communities where there has been a historic trend of stigmatizing mental health or utilizing mental health services, doing more psychoeducation work in those communities, and really like reinforcing to say things like it's good for you, and being open to talking about or sharing their own experience with using mental health resources as a way to normalize that and reinforce and encourage more wide use of mental health services.
Thank you for that. Question about long-term impact. What do you see as since this is a collective experience, what do you see as the long-term impact on the country's mental health status?
I can jump in on that one as well. I think we heard the term flattening the curve early on, and that was in reference to our medical surgical facilities and ventilators, et cetera, and rings very true these days. But quickly, I took flattening the curve to also imply the mental health arena, and that what we're doing now, what we're doing in January, February, March, what we're doing next summer is going to continue to flatten the curve regarding the long-term impact on mental health. And the impact is significant. And one of the findings in the COVID stress syndrome study did suggest that in the end, and not to minimize in any way, shape, or form the impact on the loss of life and the physical health, but when this is all said and done, the likely mental impact will be greater. But again, I can't stress enough that what we're doing now, what we're doing tomorrow is going to be critically important to flatten that curve. So again, starting with self-care now, as Dr. Wang mentioned, accessing individual therapy, family therapy, if there's more intensive services needed. One thing that we do know about mental health is that intervention works, and that most of these conditions, all of these conditions that we're really talking about, are very treatable. But obviously, early intervention is critical to flatten that curve.
Can we talk for a moment about the telehealth? I believe, Dr. Wang, you mentioned the telehealth options that are now available. Can you each speak to how you saw the telehealth come into play and the role that it has played in the treatment, and where you see telehealth going in the future?
I definitely see that as playing a very critical role right now. I actually saw a survey yesterday saying that there has been a soaring demand for telehealth and teletherapy services specifically over the past couple of months. Right now, I've been working only remotely, and I feel so grateful that a lot of people are able to use telehealth telehealth and teletherapy as a way to continue their self-care. And it's also great that most commercial insurances are covered that cost. Right now, with all the clients that I've been working with, everybody has been able to get their teletherapy services reimbursed, which is great. I definitely see that this would be a trend that probably will continue as time goes, maybe even after the pandemic is over, because during this time, working remotely has enabled me to help people not just living or being able to come to the practice, but also people who need to travel outside of the state. And they can just have the convenience of accessing therapy from their home or their workplace, but it's in a confidential environment. So in that sense, that's definitely a really good trend. The only thing that I miss is about being able to see to see people in person and seeing their whole body and being in a shared space, that is irreplaceable. But right now, it's better to have teletherapy than not, right? So.
Right. And just to add on to that, I mean, I think with teletherapy, this is not a new concept. This has been around for a very long time, and it has actually been shown to be just as effective as in person, especially when what studies done evaluating CBT-based teletherapy. Not only has it shown to improve the ability for people to access mental health services, definitely in remote areas where there's limited access to mental health providers, but what we are seeing is that it's still the same level of care, the same level of services that you would get from an in-person type of session. I will say that the advantages of teletherapy, too, is when you're using this type of technology with kids. I mean, we once thought that, we're not going to be able to get kids engaged in teletherapy. Well, we're not seeing that to be the case. Actually, kids are doing very well when it comes to technology. In fact, I've got 8-year-old clients that are teaching me how to use Jamboard on Google because they use Google Classroom. So we're finding different ways, different innovative ways to really get them engaged and to participate in their treatment and therapy, which is really great to see.
And moreover, great question to echo Dr. Wang and Dr. Yusefi. At Dominion Hospital, we stood up teleprograms relatively quickly within really by early May. So our outpatient programs, our day treatment or partial hospitalization, which is 6 hours a day, our IOP programs, which are evening programs, 3 hours a night, those all have virtual offerings. And, to some degree, we call it consumer confidence, really meeting people where they're at. We still obviously offer brick and mortar services. People, may feel the need to come physically to a program so they can still show up live and in person. And that includes assessments as well. So folks, we have in-person assessments, but we can also do virtual assessments and really meeting people where they're at. Same thing with our outpatient programs. We can do it in person. We can do it virtually. And to echo Dr. Yusefi and Dr. Wang, it's been very successful. I mean, we have teenagers doing PHP for 6 hours a day virtually. So being on in the morning, attending groups, logging off for lunch, et cetera. So I see it continuing well into the future.
That's great news. And we have time for just one last question. Dr. Yusefi, I believe you mentioned demographics and some of the fact that women may have been experiencing higher levels of mental health challenges throughout. Did you see any demographic data on socioeconomic levels? And I'm asking that specific to the question about impact on homes. What kind of data did you see there?
Right. So, I mean, what we're seeing from the survey and even from Dr. Reppie's discussion on the statistical prevalence and the impact of COVID-19 economically is that, with subgroups of people who are within a lower socioeconomic status, who do not have a lot of resources, whose their homes are their living residences are getting impacted, we're going to see a higher incidence of mental health problem as a result. And when we conceptualize it, I mean, you think about what resources do they have available, when they may not have, when they lose their access to health care, lose their access to even being able to seek mental health treatment and support. So what we're seeing, in studies now is, yes, these subgroups of populations of individuals within lower socioeconomic status are getting greatly impacted mental health-wise and are within that vulnerable group of population of patients. I mean, not to say that, individuals who have all of these other psychosocial risk factors don't already have a risk of developing mental health, issues, but we're seeing definitely a much greater impact related to COVID.
Some important policy follow-up there, perhaps. Well, I think that's the time that we have for questions. I want to thank all of you for being here and to thank Dr. Kubik for introducing our session, and I'm sure we'll follow up more on this important topic. Thank you, everyone.
Thank you.
Thank you.
Thank you.